What's up, guys? It's John here with Freeman Fitness. Today I'm going to show you a few simple techniques to self-treat tennis elbow or golfer's elbow. This video is not geared towards educating you about what these two diagnoses are exactly. You could always look those up, or I can make another video explaining. But today, if you've been diagnosed with tennis elbow or golfer's elbow, or lateral elbow pain, or medial elbow pain, also called lateral epicondylitis, if it's on the outside, which is tennis elbow, or medial epicondylitis, which is golfer's elbow. You're gonna treat these very similar. They're inflammations of the tendon, all right? The first thing you need to do is calm down the inflammation. So you wanna use ice. I found this awesome gel pack on Amazon. It's literally just a sleeve with a little bit of gel that you throw in the freezer. You leave it in there for a couple hours. It's frozen. You put it on your elbow, and you can do all your daily activities while icing the arm. The ice usually stays cold for about 20 minutes or so, which is exactly what you need. You want to be icing for about 20 minutes, 3 times a day or after activity, okay? So that's treatment number 1. You're going to ice it at least 3 times a day for the first 7 to 10 days. Number 2, you're going to want to make sure that you put some kind of brace on it to make sure that you're not going to continue to irritate that tendon through your daily activities or whatever that you did to cause the pain in the first place. My favorite brace of all is like a crisscross brace, or a brace that has straps that go both ways. So this one has a sleeve, slide it right up over the elbow. One strap goes over clockwise, the other one goes around counterclockwise. So it gets that kind of crisscross compression, and then it's also open at the elbow joint so you can still bend the elbow, okay? Love this. It creates good compression through the tendons, but it also allows good free motion so you can still do your daily stuff. Do you have to wear this all day? No, but if you know you're gonna be lifting weights, playing a sport, or doing some stuff around the house that involves a lot of gripping activities, you're gonna wanna throw this on, leave it on until you're done with that activity, and then you're gonna ice. I have another brace here that's pretty common. This is just like a compression strap. I don't love this, and I'll tell you why. It works pretty good for compression. So basically it has this little pad here. That's where you're gonna put on the tendon that's bothering you. So let's say you're having tennis elbow, and this tendon here is the one that's bothering you. You're gonna slide this brace on so that that pad goes right on that tendon. And you're gonna strap this down nice and snug so it's compressing on the tendon. It does a pretty good job. The reason why I don't love it as much is there's no open spot for your elbow to bend. So when you bend all the way, your soft tissue ends up squeezing against that. It doesn't feel very good. Now you can slide it down a little bit and still get a pretty good compression on where you need to. But still, if you're like doing a lot of elbow bending, as you bend and your forearm expands, it creates a lot of pressure into this. It works. I mean, it's to your tolerance. I don't love doing it. For some reason, I feel like it hinders me. I feel it when it's on. Even though this one seems more bulky, it's pretty lightweight. It stretches really well, and it does the purpose. But you can try either one of these. I would go with this first. I feel like this has done the trick for me many times and my clients, but some people like this too if that one's not working. Those are your 2 compression options. You could also go with just like a straight compression sleeve, which is like Copper Fit, Tommy Copper. Those work decent as well. All right, so you're icing it to calm down the inflammation. You're bracing it so you don't irritate it more. And then you also want to relieve the tension through the muscle, okay? A couple ways to do that. Let's say you're dealing with tennis elbow or lateral epicondylitis. It's the inflammation of this tendon here, which is affected by all these muscles that run through the top of the forearm. First option is while you're sitting there watching TV or hanging out, you could use your fingers. Find those muscles, poke around a little bit until you find some tenderness. Once you find tenderness, you want to put some pressure on it, hold for about 20 to 30 seconds. You could do some light oscillations back and forth. Again, about 20-30 seconds on the same spot, and then move to another spot that might be bothering you. You want to spend about 2 to 3 minutes doing this 3 times a day. All right, it'd be the same if you're dealing with golfer's elbow, right? So the golfer's elbow is this tendon here, and it travels down It's usually a result from tight muscles in the wrist flexors, right? So you could run your thumb through there as well and do the same thing. Poke around till you feel some tenderness. When you find an area that's tender, hold for about 20 to 30 seconds. You can oscillate back and forth. I also like a scraping technique. You use your knuckles, you just scrape it up and down. Again, same idea. The total massage time, about 2 to 3 minutes, should do the trick 3 times a day. It's hard to really overdo this as long as you're not putting too much pressure. You're trying to get blood flow to the area, all right? And then the other option, if you don't want to use your other hand, or if you're dealing with bilateral elbow pain, you could use a golf ball. So what you can do is put the golf ball right on the table. Put like a towel on the table so that the golf ball's not rolling all over the place. Essentially what you'll do, let's say you're dealing with golfer's elbow on the inside, just put that golf ball right on the area that's bothering you, roll it back and forth until you find some tender spots. If the golf ball's rolling all over the place, you can hold the golf ball in place and just put a little pressure. Again, same thing, hold for about 20 to 30 seconds on the spots that's tender and work it for about 2 to 3 minutes, finding different areas as you do it. All right, immediately when you're done with that, you just increased your blood flow. Then you'll go to a couple basic wrist stretches. All right, number 1, if you're dealing with lateral epicondylitis or tennis elbow, put your arm straight out, grab the top knuckles, pull down. You should feel a stretch over the top of the forearm. Hold it for 30 seconds, 3 times, shaking it out in between each repetition. I'll do that 3 times. If you're dealing with golfer's elbow, which is the medial epicondylitis, grab your fingers, elbow straight, pull straight down. If you're not able to do that motion, you can use a table, put your hand here, nice and easy, and just press down to the best of your ability. Now you don't want to go to the point where your elbow's screaming at you when you're stretching. So as you start to feel a nice, light, gentle stretch, hold for 30 seconds, work on your breathing through that 30 seconds, and then over time, that intensity of the stretch shouldn't be as bad. All right, so start with those. Those are 3 ways to kind of relieve some of the pressure. It's in the early phases of your rehabilitation, but it should get you back to your activity relatively quickly. So you're icing, you're bracing, and you're stretching, all right, for the first 7 to 10 days, and then see where you're at after that. Like always, this is suggestions. You should always, if you're having a lot of pain that's hindering your ability to do daily activities, you should always see a doctor. But here's a couple things you can try to do on your own before having to, get any more treatment done on it. All right, so give that a try. Comment below, let me know what you think, and I hope that you guys get back to doing what you need to do, healthy and happy.